Action of HIV-positive children was tremendously reduced by introducing a comprehensive HIV testing center for HIV-positive pregnant women.
During the antenatal clinics, we have group counseling sessions. So there is somebody who actually talks to them as a group. Then at the end of all that, they would ask for those who have not been tested, and usually people will volunteer to be tested. At the initial visit, some of them will not accept to be tested, but subsequent visits, we re-emphasize the need to test them.
Giving the mother an option to breastfeed or not to breastfeed is a very successful program. Most of all the mothers that you see here have children who are very healthy because we have monitored them for a time now, for a period of 5 years.
3 public hospitals in Central Province, in Maragua, Karatina and Nyeri Provincial General Hospital, have successfully used this scientific evidence to implement a comprehensive program that target interventions in the antenatal clinic, where pregnant mothers are tested for HIV, CD4 count and antenatal antiretroviral prophylaxis or treatment initiated accordingly, aimed at reducing the risk factors associated with mother-to-child transmission of HIV.
Health officers working in the district felt frustrated because we were seeing pediatric infections and we could not treat them. So we decided that we had to come up with an intervention program so that rather than talk about putting under care so many children on treatment, we talk about minimizing infections to almost a manageable level.
Testing rates are probably in the region of 95–96%. So it's a very small percentage who will decline. And if they decline, that's their right.
A recent evaluation of the results in 3 hospitals indicate that 294 infants born to HIV-positive mothers tested negative after a test was conducted as from 6 weeks of age.
We have 500 children who are HIV positive in the district. That's equivalent to like a primary school. But that picture is changing, and it's changing because of the interventions that we are putting in place. Initially, we could enroll as many as 30 children per month, but now we are enrolling as few as 5 or 6 in a month.
Mwaka na nusu akaja akapimwa tena, pia akaambiwa ni negative akiwa na mwaka na nusu. Nifurahia hiyo kitu sana kusikia ati mtoto wangu ako pamoja na watoto wengine.
With replacement feeding amongst women to their infants, the concept of introducing a similar scenario in government hospital countrywide is said to be underway. Zipporah Karani, KTN Weekend Prime.
This is no ordinary family. These children's parents have lived with HIV for almost as long as they have been married.
Nimekaa kama miaka 10 nikiwa na virusi na nimezaa watoto wawili na hao watoto wako negative.
Just before Martin was born, his parents discovered that they were HIV positive. All they knew at the time was that Martin was not supposed to breastfeed to protect him from getting infected through his mother's breast milk. 8 years later, with information from an HIV/AIDS comprehensive care center in Maragua District Hospital, Duncan Karani and his wife Jane decided to have another child.
Pmtct, Prevention Mother-to-Child Transmission, kanisaidia mpaka ikanielimisha vile tunaweza kupata mtoto bila virusi, na nikawa hata na mimi nimeonelea ni kweli juu nimepata watoto wawili nikiwa na virusi na hana virusi. Wewe.
The Karanis are a living proof that the Pmtct program works. They are now enjoying parenthood just like any other couple.
Being HIV positive does not kill the desire to have a child. So they want to get a child. But what we have to do is to make sure that we give them the benefit of getting a HIV negative child.
Lazima mwili iwe imeangaliwa kabisa, uwe umekunywa dawa mpaka mwili immunity imekuwa juu kabisa.
Nilipata mtoto wangu kawaida na nikafurahi sana.
I know the happiness that comes with having a baby who is HIV free, and I also I appreciate the stress and devastation that comes with a baby who is HIV positive, because it doesn't matter how many other children are held in that family, that child is going to affect, the child who becomes HIV positive is going to affect every other member of that family.
6-month-old Winnie has been on replacement feeding since she was born. This powder formula is as close as possible to her mother's milk. Her health is just as good as any other baby's her age. This, however, is not the only family celebrating the negative HIV status of their children.
We have now tested 147 children confirmed negative from HIV positive mothers.
Over 700 mothers have been enrolled in the Pmtct program in Central Province. More than half of them have come here to celebrate the success of the program.
If we are able to capture the mothers early enough in pregnancy, give them the appropriate information and treatment, it's possible to reduce infection to 1%.
We're trying to create an HIV-free generation in Central Province, and we hope that this will be the start of a whole model for the whole country.
He says the success of the program is because replacement feeding is given for free to mothers here. If this was available in Pmtct programs countrywide, then we'd be moving some steps closer to an HIV-free generation. Sylvia Chebet, Heartbeat, Citizen News.